Welcome back to part 7 of training muscle lengths. Part of the point of this series is to make things as simple and accessible as possible for all of you. So before we start talking about the musculature of the back, including the lats, the shoulder, the chest, we first need to explain what the shoulder joint and the shoulder girdle actually are and establish some very basic terminology so that you understand what I'm talking about when we get into all that musculature. I promise we're getting to the lats, just bear with me. When we talk about the shoulder, the chest, the back, you're probably thinking about what happens here. That's the glenohumeral joint, which is where the humerus and the scapula meet together. That's what we call the actual shoulder joint. Now, the shoulder joint and the shoulder girdle, which you see below, are separate entities and can get very confusing, so we want to make sure we know the difference. The shoulder girdle is the interaction between the scapula and your clavicle, as well as the sternum. When we do get into that musculature, we'll also talk a little bit about ribs, but for now we're just going to focus on the shoulder joint and shoulder girdle. So first, talking about the different movements at the shoulder joint, which there are a ton. We have flexion, like you're raising your hand to ask a question. Extension, which is just bringing that hand back down to where it came from. And like on our previous videos, we always talk about hyperextension, which is just extension beyond the midline of the body. We also have abduction and adduction. You'll hear me say abduction for abduction and adduction to clarify because they sound very similar. Basically, abduction just means away from the body. In this case, the abduction is straight out to the side, and adduction is the opposite. We always remember ADD, add, like we're adding that arm back to our body. Think of these two as your stereotypical motions for a lateral raise, versus horizontal. AB and adduction are the same thing, but horizontal like in some sort of a fly variation. We also have lateral and medial rotation, which you've probably heard referred to as external and internal rotation. We won't talk too much about those. And you'll notice I skipped circumductions, basically a combination of multiple shoulder movements. It doesn't really have a purpose in any of the training stuff we talk about. Now remember, those were all shoulder joint movements, so all of those happened right here. None of them involved the scapula itself actually moving. That's important to note because if you look back to our abduction, see how the arm doesn't go all the way up straight? That's because in order to get that arm all the way to the top, motion starts to occur at the scapula in upward rotation, which we'll talk about right now. When we talk about these scapular motions, we're not talking about the arm at all. So if you somehow didn't have a humerus, you'd still be able to complete all of these motions. We have elevation, like pulling up in a shrug, and depression, which is the opposite, as it's coming back down, or if you just held on to a really heavy weight and kind of pull your shoulders down. We have adduction, or more commonly called retraction, which is when we pinch our scaps back, like maybe at the top of a row. And then the opposite, which is abduction or protraction. Just imagine giving someone a hug and your scaps having to come forward. Then we have upward rotation, like we talked about, which is what brings that arm all the way up near our ears, and downward rotation, which is the opposite. We'll start getting into this musculature in part 8.